A focus to Bengaluru, where a 34-year-old mechanic died after he and his wife were forced to shuttle between hospitals on a bike in search of urgent medical care, allegedly facing indifference from both hospitals and passerby along the way. The man, identified as Venkat laid on the road, writhing in pain for several minutes as his wife pleaded for help with folded hands. Cars continued to pass by without stopping. Help eventually came from a cab driver who finally stopped to assist, but by then it was too late. By the time they reached the hospital, the 34-year-old was declared dead on arrival, leaving behind a 5-year-old son and an 18-month-old daughter. Let's listen in to what the wives ordealed.
I'm standing outside Real Life Hospital in Banshankari, Bengaluru, where 34-year-old Venkat was brought by his wife after he complained of severe chest pain on the morning of December 13th, around 3:30 a.m. to 4 p.m. He's complained of severe chest pain and his wife has rushed him here. This is the second hospital he was brought to. His wife first took him to another hospital that is located around 300 meters from here, where the hospital authorities are said to have told the couple that no doctors were available at the moment. Then the wife rushed the 34-year-old man here to Real Life Hospital in Banshankari, where an ECG was conducted and the doctors diagnosed that he suffered a mild heart attack. But the family claims that the hospital did not provide any initial medical treatment or provide any ambulance for the couple to move to another hospital. He was advised to be taken to Jayadeva Hospital in Jayanagar, but the family claims that neither did the hospital provide any initial medical treatment nor did they give an ambulance. Ma'am, on the night, what exactly happened? How did it begin? What is the sequence of events? Please tell us.
From morning 3:30, this incident has happened. He was paining more. It was paining more. So what he done? He vomited. After vomited, he went. I told to him I'll call a sister, but he didn't wait. He took his scooty and he went out. I'll go to hospital. If you come, you'll come or no? I don't want. I'll go to hospital. After that, I went to hospital. I went with hospital, but the duty doctor was not there. After that, hospital of security, he told that go to Real Life Hospital. We went to Real Life Hospital. They took ECG and all. After taking ECG, my husband asked him, you give any treatment for this or you give any tablet? But they didn't give. They asked also whether you came, how did you came? They asked. He said we came from two-wheeler, but they didn't give any ambulance facilities also. After that, they told to go to Jayadeva Hospital. We went to Jayadeva Hospital. In Kadrinalli Circle, he got an accident.
He was driving.
Yeah, he was driving. When he was driving, got accident. After that, I'm begging all of them, but no one helped me. After that, lastly, after 5 to 10 minutes, his sister came. After that, she gave CRP and all. After CRP, he didn't wake up. After lastly, one cab driver came and stopped. After that, he took and went for Dayananda Sagar Hospital. In that Dayananda Sagar Hospital, so they took ECG in car only. They didn't took and went inside of hospital also.
Now, CNN News 18 spoke to Karnataka Health Minister Dinesh Gundu Rao, who assured the action in case of negligence. Let's listen in.
You've seen this incident from Bangalore. Several questions. One on the preparedness of a hospital, whether they should have a cardiologist or an expert at hand at that time and at least arrange the ambulance. Is this something that the government will look into, sir, in the coming days?
No, I've heard, about this incident, and we are looking into it. Basically, we need to find out exactly what happened and what was the, actual sequence of events and what are the facilities in this particular hospital. Basically, we have under our KPME that anyone in an emergency, the hospital should not turn away the patient. So that treatment should be given, emergency services should always be given to the patient, whoever comes in. But here it depends on whether the hospital had the required facility to treat them or what was the advice based on all those things. So looking into all that, definitely if there's any wrongdoing by the hospital or any negligence by the hospital, we have laws which definitely we can take action on them. but we need to investigate it further, and then then take the next step, I think.
Is the health department going to do that, sir? Look into this specific matter?
Yeah, first of all, we will look into it. I mean, suo moto, I don't know, I have to just check, because we need to get the complaint either from the police or from somebody that this is what happened. That is one thing. But anyway, I've told my officers to just check on this and see what is the information that we can collect before that. And then if there's any complaint or if there's any specific request that negligence has happened and we were not provided proper medical services from that hospital, then that also could be a starting point. But anyway, I've told my officers to suo moto look into everything and collect the information. Then we will.
A former health minister, Dr. K. Sudhakar, spoke to CNN News 18's Rohini on this matter. He has slammed the state government for being so oblivious to people's suffering. Let's listen in.
If the hospitals had been told that patients should not be turned back, we would not have lost a life today.
Absolutely, Rohiniji. See, in an emergency, time is life. When a patient walks into an hospital in distress, treatment cannot wait for any paperwork, approvals, or formalities. Delaying emergency is not just medical negligence, in my opinion. It is a moral failure. And if a patient like this collapses because treatment was denied or delayed, accountability has to be and must be fixed, in my opinion. See, healthcare is not a favor, it is a fundamental duty of the medical health system. So I think it is a constitutional and rights. It is not optional. It is a basic right of a human being to save his life.
But isn't it also
living
stringent?
in a civilized society, and if somebody is not, given a proper treatment in time, and that person succumbing because that treatment was denied for him, is really crime, in my opinion. Such facilities or such doctors or such medical staff who have denied the treatment has to be punished, has to be accountable, is what my opinion.
But Dr. Sudhakar, don't you think the onus is also on the government to have more stringent measures and laws, also asking hospitals not to do so?
See, we have laws in place. When I was a health minister, I had made this law. Ultimately, laws has to be enforced, and every citizen, every responsible individuals should be morally binding. See, after all, what is health system today? Everybody, right from doctor to nurse, we all take oaths.
Right.
If we are, irresponsible, then where the society is going?
Now, one of the hospitals the couple went to was the Real Life Hospital. While speaking to CNN News 18, the hospital has denied all the family's allegations. Let's listen in.
Ma'am, the hospital, like I said, has claimed that you have not provided initial medical treatment. Only an ECG was done and the couple was sent away. They were also not provided an ambulance. So what is the hospital's stand on this?
See, the patient came around 3 o'clock, 3:30, something like that. And as soon as the patient came, here the staffs have taken them inside emergency. They have immediately done a ECG. As soon as the ECG report came, they have showed that, okay, it is an MI. So after that, whatever the loading dose we are supposed to give, we have given them and told them, see, this is what is the condition. We don't have a cardiac facility here. So we referred them to Jaideva. They didn't wait. They just rushed to Jaideva. And during this thing, since their patient was critical, we didn't even charge them anything. We just said, okay, you get well, and then if you are okay, then you can come back and pay. This is what the actual scenario happened that night.
Ma'am, also about the arrangement of an ambulance, the family also claims that they did not get an ambulance it was not provided to them. So, your clarification on that?
So actually the ambulance is not right. The time they had come, the ambulance was not here. We called the ambulance, they didn't wait for the ambulance to come. So that is what has happened, and they just rushed in two-wheeler. If there was some attender other than him who would drive it, then maybe he would have reached.